The following is sponsored by Medical Media Group and the following physicians and healthcare organizations.
Today on the American Health Front, we'll explore minimally invasive and surgical treatments for vascular disease, which affects the arteries and veins. If you have sinus issues and sleep problems, you need to know that these concerns can be connected. We introduce you to a specialist who offers in-office treatments that can help. For many seniors, remaining in their own home is very important. We learn about an innovative continuing care at home program that helps keep them healthy and independent. Hello everyone, I'm Marty Caniglio. Welcome to the American Health Front. The purpose of our program is to educate and inform you, the viewer, about treatment options now available in the ever-changing world of medicine. This is a special Detroit edition of American Health Front. Our staff has teamed up with some of the area's finest physicians and healthcare facilities to explore the fascinating frontiers of today's healthcare, with reports on new techniques and technologies that could change your life. Stay with us, because there's nothing more important than your health. We'll open our program today by focusing on vascular disease. Vascular surgeons are specialists who can correct issues within the blood vessels, which, if left untreated, could lead to serious health risks, possibly even death. Board-certified vascular surgeon Dr. John Ilges and his skilled team at Vascular Associates of Michigan, PC, one of the busiest vascular surgery practices in Michigan, with 5 clinic sites throughout Metro Detroit and surrounding areas, specialize in complete vascular and endovascular care of diseases which affect the arteries and veins.
We are a three-man board-certified vascular surgeons. We are facile in both open vascular surgery and endovascular surgery, which is the less invasive procedures. Our practice really takes care of the whole comprehensive realm of vascular medicine. That includes aneurysm, carotid disease, circulatory or hardening of the artery disease, dialysis access, all the way to venous disease, like folks with swollen legs and varicose veins. So we take care of the entire spectrum of vascular disease at our practice.
One of the most important keys to successful treatments is an accurate diagnosis.
We use ultrasound, we use a C-arm X-ray machine that's behind me. We also use monitoring systems for while they're sleeping, cardiac monitoring, EKG monitoring, oxygenation, all those kinds of things to maintain the patient's safety as well as treat the patient appropriately.
These vascular specialists provide both minimally invasive and open surgery choices.
As vascular surgeons, we are certified to perform endovascular and open procedures. We are very selective in which patients we do open and which patients we do endovascular on.
Vascular Associates of Michigan, PC, the experts in vascular care. Do you have chronic sinus problems? Do you have trouble sleeping? It might surprise you to learn that these issues can be connected. Sleep problems, such as narcolepsy, can cause sinusitis, and sinusitis can cause sleep problems. Dr. Arthur Rosner is an otolaryngologist, or ENT, and is one of the 6 ENTs double-boarded in sleep medicine in the state of Michigan and has performed over 1,000 very successful sinus surgeries.
Sinusitis is a disorder of inflammation of the sinuses. This can involve infections, sinus pain, pressure, postnasal drainage. It can disrupt your sleep at night. Some patients have symptoms that look like narcolepsy. These patients respond very well to pneumonia vaccines, and when you treat their narcolepsy, they sleep better at night, and thus they get sick less.
Dr. Rosner performs various evaluations and tests to determine the extent of chronic sinus problems.
The first thing we do is we take a good history. We use a form called a SNOT-22 that they put down their symptoms, such as is their sleep disturbed, smell, taste, nasal blockage, pressure. We then do an exam to look if there are any blockages in the nose.
Dr. Rosner has been able to provide relief to his patients using a balloon sinus treatment, a minimally invasive in-office procedure.
In the office, we use balloons to dilate the sinus openings, thus relieving the facial pressure, allowing patients to sleep better at night and then get less sinus infections. This is done almost painless. Patients get relief almost immediately with minimal recovery. Performing the procedure in the office has less bleeding, it's safer, quicker, and about a third of the cost of doing it in a hospital setting.
After seeing Dr. Rosner, I feel 100 times better. I don't have that pressure in my face anymore, my cheeks, my forehead. I feel like a new person.
Dr. Arthur Rosner, ear, nose, and throat specialist, helping your sinus problems so you can sleep better and feel better.
If you'd like more information about anything featured on today's program, or if you miss any of the important numbers that are shown throughout our program, please call 1-800-984-2010.
Would you like to improve or change something about your face or body? Maybe you don't like the shape of your nose, the size of your breasts, or just want to look better. Superior technology can help improve your self-image, but what if we told you that you can actually see 3D images of what you'll look like after your surgery before you have surgery? Well, you can. Plastic surgeons Dr. Michael Shendon and Dr. Mazen Haraki are among the few physicians in the Michigan area who offer Vectra 3D image technology.
The Vectra is a 3D imaging system that we use extensively for rhinoplasty, breast surgery, and body contouring. It's a system that allows us to take multiple images of a patient simultaneously and then develop a 3D image on the computer.
This amazing technology allows patients to preview various surgical options and decide on the procedure that best suits their personal goals. No more wondering what you will look like.
The entire process of taking a patient's photo and converting it to 3D is easy and completed within minutes. The 3D image is then analyzed, incorporating the patient's concerns, and a simulated surgery is performed. The patient then has the opportunity at the consultation to see their surgical outcome before having surgery. This improves communication between the patient and the surgeon by having a better understanding of the surgical options and desired outcome. This visual aid ensures that both the patient and the doctor agree on the surgical plan. I use this technology for the majority of my consultations. This is definitely cutting-edge technology.
We've seen a significant increase in patient satisfaction with the use of this device.
Looking at the machine helps you see what your results will be after the surgery. So that's what convinced me to get the surgery.
The skilled team at Michael J. Shendon, MD, PC helps you accomplish your aesthetic goals because seeing is believing. There's lots of reasons for pain. It could be the result of an injury, an accident, or just everyday wear and tear on our bodies. Chiropractic care has been around for over 100 years. It's a natural healthcare science that focuses on the spine and nervous system and how they can impact your overall health. Chiropractor physician Dr. Cecil Forbes, along with a highly trained team at Eye Care Spine and Rehab Center, treat the whole person, not just the pain or symptoms, to help the body heal itself.
Eye Care Spine and Rehab Center, I like to call it my healing sanctuary. What we do here is a more laid-back, spa-like experience to our patients so they can become more relaxed and the adjustments and the treatments will be more easier. It's more like a homely atmosphere. Well, here at Eye Care Spine and Rehab Center, we deal with low back pain, neck pain, whiplash injuries from car accidents. We deal with numb and tingling that mimic carpal tunnel injuries. One of the biggest new phenomena that's going on right now is text neck. Text neck, basically, it deals with a person that has always had their head tilted down while they're reading their phones. With that, you'll get a loss of curvature in your neck. It'll send pain not only in your neck, but shooting down your shoulders into your hands.
The eye care team provides healthy, non-surgical alternatives.
Well, one of the devices that we use is our spinal analysis machine. It not only checks their posture, but it will also check to see if they had anterior head carriage. With that anterior head carriage, it'll let us know if their head is sitting properly over their shoulders, which it should be. The philosophy of chiropractic is that we help people get healthier without the use of medication. It's retraining the vertebrae and the muscles to realign in a normal fashion over a period of time. Studies have shown when dealing with low back pain, chiropractors are number one in treating those issues.
Eye Care Spine and Rehab Center. Safe, natural care to help the body heal itself. Most of us don't give much thought to our gums or know why they're important. The main role of our gums is to protect our teeth, and healthy gums also play a vital role in our overall health. Board-certified periodontist Dr. Joseph Nemeth and his highly trained team are among the elite list of practices who have the skills and experience to provide the most advanced choice in gum treatment available today, the pinhole technique. Created by Dr. John Chow, it's changing the treatment of gum disease.
The pinhole technique was designed to treat gum recession. As we get older, very often our gums recede, we get long in the tooth. When you have gum recession, the bone tends to recede along with it. It becomes sensitive. It doesn't look so great.
Dr. Nemeth tells us how this technique is transforming gum disease treatment and why it's very important to treat gum recession.
We make a small pinhole in the tissue, and through that pinhole we take specially designed and patented instruments and we loosen the gum tissue. Once that gum tissue is loosened, we can bring it up, or in the upper arch, bring it down over the receded roots to cover them as much as possible. And then we take a reinforcing material, something like a collagen membrane, and put it through that small pinhole to thicken and hold the gum tissue in its new position. This technique was developed by John Chow about 10 years ago, and it's revolutionized, at least in my practice, revolutionized the treatment of gum recession. I love helping people. I can help people get healthier. I can help people save their teeth. I can help people look better. I can help people feel better about themselves and more self-confident. I have some patients who it changes their lives. And when it changes their lives, it makes my life better. I just love helping people that way.
With the procedure done, I have a whole new gum line now. You can even tell that the gum line had receded, and it just looks phenomenal. I can smile again.
Dr. Joseph Nemeth and associates combine experience with top-notch treatments to give their patients healthy mouths, healthy smiles, healthy bodies. If we want to maintain our natural teeth for a lifetime, we have to take care of the supporting tissues around the teeth. In instances where teeth cannot be saved, dental implants are the superior option to restore proper oral function and aesthetics. Board-certified periodontist Dr. Lauren Anderson is a specialist in advanced dental implant placement and modern management of various dental and implant diseases.
Much like diabetes, patients with periodontitis are not aware of their condition. Clinically, this is diagnosed with bleeding, increased pocket depths, bone loss, mobility, and eventual tooth loss. Although implants have high success rates, they can become infected. This is called periimplantitis. It's an infection of the supporting structures of the implant. With early diagnosis and triage, implants can be saved for proper function and aesthetics.
Dr. Anderson takes treatment to another level by offering minimally invasive soft tissue plastic surgery to correct receding gums for a more stable and youthful smile. Patients experience very little downtime and discomfort due to their conservative approach. Extensive training in anesthesia allows Dr. Anderson to provide a gentle and safe sedation experience. At Anderson Periodontal Wellness, Dr. Anderson uses the latest in guided three-dimensional technology to safely and accurately place dental implants. This same technology is also used for tissue engineering, where tissues lost to disease are regenerated to restore your oral health.
With 3D technology, a 30-second CBCT scan is taken to give us an image and real feedback on the anatomy of the patient. This allows for a more precise and safe dental implant experience. Patients that have this procedure completed experience very little downtime and discomfort due to this conservative approach, as it is less invasive than traditional techniques.
I would recommend Dr. Anderson highly. It really, from beginning to end, was a wonderful experience, especially for somebody like me who has a lot of anxiety and fears regarding any kind of dental work.
Dr. Anderson and her team at Anderson Periodontal Wellness provide personalized care, superior treatments, experience you can trust. Do you realize that muscles play an important role in dentistry? In fact, if the upper and lower teeth do not fit together properly, it can result in a painful condition of the head and neck, also known as temporomandibular disorder, or TMD. Dr. Jeffrey Haddad and Dr. Kurt Doolin and the highly skilled team at Rochester Advanced Dentistry provide their patients with the most comprehensive care possible in dentistry.
So there's three things that dictate your bite. It's your teeth, the TMJ joints, and the muscles of the face. And your teeth dominate the situation. And so wherever your teeth are, your muscles and your joints have to accommodate. And a lot of times they accommodate at a price, which is pain.
The most common symptoms that we see in our patients are head pain, neck pain, jaw pain, pain behind the eyes, sinus congestion, ringing in the ears, swishing or fullness of the ears.
Treatment is personalized after a complete and thorough diagnosis because every patient is different.
Most of our testing for TMD, a lot of it's subjective. We rely on what our patients are telling us, and they're giving us clues to the problems. We also do a very thorough examination of the muscle and skeletal system of the head and neck. And above all, we really check for severely worn dentition, malposed teeth, real crooked teeth, and bad bites.
Because the doctors use the patient's own body and physiology to guide the treatment, patients start to feel relief very quickly.
If the muscles are in tension, then that's where a lot of symptoms happen. And so it's our job to identify these patients, relax their muscles, find out where their proper jaw position is, and then stabilize it with what we call an orthotic. It's very comfortable for patients, it's non-surgical, it's conservative, and it's very precise.
I eat with it, I sleep with it, I take a shower with it, I do everything with it. And you know, it's the best thing that's helped me overcome this TMJ disorder.
Rochester Advanced Dentistry uses modern treatments to help patients with TMJ disorders suffering from headaches, migraines, and even ear ringing and vertigo or dizziness. Everybody loves to smile, but some people are embarrassed about their teeth. A bright and beautiful smile can do wonders for your self-esteem, social life, and business relationships. It's important to find a dentist that not only offers the most advanced technology, but also one who understands how the teeth come together while chewing. Dr. Justin Newingham is one such dentist. He, along with his highly skilled team at Newingham Dental Center, provide complete dental care for all your family's needs to create healthy, beautiful, and natural-looking smiles, all under one roof.
You know, sometimes people present to our office with veneers that have already been done, maybe 5-6 years ago, and they're cracking or they're chipping. It's very obvious that, you know, from my perspective, that there's an issue with how the teeth are coming together when they bite, when they chew, when they use their teeth. And that can put more wear and tear on the restorations that people put in their mouths.
Dr. Newingham combines expertise, advanced dental treatments, and an artistic touch to enhance your natural smile.
We can do the full mouth reconstruction where patients are missing multiple teeth. We're trying to restore the whole mouth into working order and also give it an aesthetic look that the patient's looking for. This patient presented with broken front teeth, chipped front teeth, and we balanced out his bite and gave him brand new crowns and veneers all across the front and in the back teeth. This patient presented to our office with almost every tooth was bonded many years ago, and all the bonding was discolored, and she didn't like the shapes of the teeth. We replaced all the bonding with brand new porcelain veneers. She's been like this for 7 years. She's loved every second that she's had wearing these teeth.
I'm really happy with final look because it looks so natural. It's even nobody can tell it's not my teeth, you know.
Newingham Dental Center takes pride in designing and creating a high-quality, stunning smile. A smile you can be proud of. Do you need restorative dental work such as a crown but put off treatment because you think it will take too much time or several appointments? The team at Gentle Dental Associates in Ann Arbor offers dental treatments that will change your mind. Dr. Tejan Layson and Dr. Neha Kutiala understand the value of their patients' time, and that's why they offer E4D, a CAD/CAM solution that helps them create custom-fit ceramic crowns and onlays or inlays in just one appointment.
There are many reasons people will need crowns and restorative work. Most reason is might be a crack on their teeth, might be trauma related, or if they're severe grinders, bruxers will cause a crack on their teeth.
So traditional methods of crown placement requires preparing the tooth, taking a messy impression that very day, fabricating a temporary crown for the patient, and then having the patient come back a second time to actually have the final crown placed.
The E4D system creates perfectly fitted, custom designed crowns and restorations while you wait.
Using this compact laser scanner, we are able to get a clean, fast, highly accurate digital impression in a few minutes. We designed the restoration that will fit perfect on the patient's tooth. E4D allows us to produce custom crowns, veneers, and inlays or onlays right in our office. Our patients love it because there's no more messy impressions, no temporary crowns, and no follow-up appointments to place crowns.
We're producing very durable, metal-free, long-lasting restorations, very cosmetic restorations in just same day for our patients.
E4D was amazing. I didn't have to take too much time out of my schedule. There was no temporary crown, and the final result was absolutely beautiful.
Gentle Dental Associates combines skill and high-tech treatments to give you reasons to smile. Wouldn't it be great if you could have a straight smile within a few months? Well, you can. Dr. Donald Zelazny of Z Dental in Franklin offers an advanced orthodontic treatment for adults called 6-Month Smiles that uses white wires and clear brackets.
6-month smiles can improve rotated or misaligned teeth, crowded teeth, uneven teeth, crooked teeth, and crooked smiles.
Let's learn how this advanced choice might be the best and fastest way for you to enjoy a straighter smile.
6-month smiles is a cosmetically focused orthodontic treatment that's performed in 9 months or less using specific brackets and wires. The treatment is for adults. It's not used to change a person's bite on their back teeth. It deals mainly with the teeth in your smile, and it's used to give you a straight smile. These braces are for someone who's basically happy with their bite but is unhappy with their smile.
Using clear brackets and tooth-colored wires that are barely visible, you can have a straight smile within 6 months.
We give patients a smile they can be proud of in a reasonable amount of time with clear braces.
I'm 6 weeks into the 6-month procedure, and so far everything is going as planned. This is a wonderful environment here. The staff is wonderful, very professional. Although it's kind of cozy here in this office, they have all of the state-of-the-art technology here, and I always feel comfortable coming here.
I'd been a patient of his for about 20 years, and he recommended this procedure for some crooked teeth and some things that I had going on, and I trusted him and decided to go through with it. I love it, very happy.
Dr. Donald Zelazny and the team at Z Dental in Oakland County have been creating beautiful smiles and helping patients put their best smiles forward since 1988. There's more to your smile than just how it looks. Dr. David Reggiani and his caring team at Reggiani Holistic Dental Center have not only been making smiles beautiful for over 37 years, they've been helping patients stay healthy too.
So in dentistry, when we choose our materials, primarily what dentistry does is choose materials for durability and aesthetics. Well, we take it a step farther, and we're looking at not only durability and aesthetics, but biocompatibility. So one of the reasons that I do not use mercury, because mercury is a toxin. Mercury is the third most toxic metal known to man. Mercury is actually 1,000 times more toxic than lead. So instead of using mercury, we use composite restorations that are definitely a more biocompatible material.
Now, We'll learn about the safety protocols Dr. Reggiani and his team employ to protect their patients' health.
Some of the things we do to protect our patients from mercury exposure, first of all, we give them certain supplements that we try to safeguard their exposure to the mercury. All right, we use algae that bind the mercury, the elemental mercury, which is the mercury that comes out of the shavings, because you're never going to pick up all of those shavings when you're taking a filling out. But you're reducing the load of the vapors to a very insignificant amount, and that's the key thing that we try to do. And we use this with a device called the cleanup device that is placed on top of the tooth that we're taking the mercury filling out of. We use copious amounts of water, okay, and we also use a separate ventilation system to also pick up vapors that particular way. So it's very important for us to safeguard not only our patients, but my staff and myself.
Dr. David Reggiani and the caring team at Reggiani Holistic Dental Center, helping your smile stay beautiful and you stay healthy. Most seniors would prefer to live in their home as long as possible, but as we age, life can present challenges. Luckily, advanced technologies and a focus on client health and wellness can expand a person's ability to remain independent and in their own home. Life Choices is one of the first providers in the country and the only one in Southeast Michigan to offer a continuing care at home program.
Life Choices is about keeping people healthy and at home for life. Unlike other healthcare solutions which focus on helping you recover from an injury or illness, Life Choices is designed to keep its members healthy and independent for life. We employ wellness coaches, therapists, home modification experts, dietitians, and other specialists who work together to keep our members independent.
Life Choices is a Care for Life program. Every person's needs are different, especially for seniors. That's why care and services are customized for each member. The goal is to keep members independent and in their own home, but the program also insures against future healthcare costs. If a member ever needs nursing home services, then it's covered at no additional charge. Life Choices members are covered for life.
Life Choices is person-centered care. Members are assigned a coach, and together they address any issues which may impact their ability to remain in their home. Services such as home modification, health, fitness, meals, housekeeping, and home maintenance are all covered. The coach works with the member and their team of health and wellness professionals to age in the comfort of their own home.
It provides the services I need in the Ann Arbor area where I live, and so when I heard about Life Choices, I thought this is a program that can help me out, and it has.
Life Choices, exceptional services, innovative solutions. It's your home. Wouldn't you rather stay in it? We've given you a lot of information. We hope it's been interesting and will prove helpful. Again, if you missed any of the phone numbers, please call 1-800-984-2010. For all of us on the program, I'm Marty Caniglio. Thank you so much for watching, and please join us next time for the American Health Front.
Accommodations provided by Candlewood Suites, Detroit, Troy. All suites include fully equipped kitchens, flat-screen HD TVs with DVD players, queen-sized beds with plush bedding, large work areas, free high-speed internet, and comfortable recliners. The preceding program was sponsored by Medical Media Group and the participating physicians and healthcare organizations.